GBS stands for Group B Streptococcus, and it's a bacterium that lives in the gastrointestinal tract, urinary tract, digestive system, and reproductive tracts. Doctors recommend that pregnant women take a GBS test and get a GBS treatment. The GBS test is typically done between weeks 35 to 37 of pregnancy. This is done with a swab test. If the swab test comes up positive, then the patient is treated with antibiotics. If the swab test comes up negative, then another test is done in the third trimester of pregnancy. The second test is the same swab test, but the swab is collected from a different spot in the urinary tract. Most of the time, it's completely harmless and doesn't cause any symptoms. However, when a person is carrying GBS, it can cause severe infections in a newborn baby. Group B strep has been notorious for causing problems for pregnant moms. It's very important to note that most babies who get infected with GBS have no signs of illness and make a full recovery. Gbs effects on pregnancy. Most pregnant women who have GBS do not experience symptoms, and ultrasound examinations show that their babies develop normally. Having GBS will not make your pregnancy high risk, but your chances of developing GBS increases your risk of sepsis, infection of the uterine lining, UTI, urinary tract infection, placenta infection, amniotic fluid. Gbs effects on the baby. When women with GBS have been given antibiotics, most of their babies do not get sick. But when babies become infected with the bacteria, it can develop into a life-threatening infection in some cases. Premature children are more likely to be affected by GBS as they still haven't fully developed the immune systems to fight off all possible risks. There are two types of GBS. Number 1. Early-onset disease. Can only occur in the first few days after birth. About 75% of those who will come down with GBS will develop it during early-onset GBS. Symptoms of GBS in babies include fever, drowsiness, feeding problems, sepsis, infection in the bloodstream, pneumonia, infection in lungs, meningitis. Number 2. Late-onset disease. Late-onset GBS, also known as Type 2, tends to occur between the first week and 3 months of life. Type 2 tends to produce meningitis, an inflammation around the brain, which could cause cerebral palsy, hearing loss or even death in some cases. However, only half of the babies with late-onset GBS have been found to have mothers who tested positive for this bacterium. Late-onset disease symptoms include fever, feeding problems, drowsiness. How to prevent GBS in pregnancy. If you are pregnant and at high risk of passing on the bacterium that causes GBS, Group B Streptococcus, to your baby, you will be offered antibiotics in labor to protect your baby. You should be offered this if you are GBS positive, you have the bacterium in your genital tract, or if you are GBS negative but you have preterm labor, long labor, over 12 hours, labor that stops and starts, or an infection, such as a urinary tract infection or pneumonia, at the time of birth.